Having cancer is really hard. You know, I don't care who you are or what type of diagnosis you have. As soon as the doctor says you have cancer, everything begins to spin out of control. Psychosocial oncology is all about helping people deal with the cancer diagnosis, its treatment, and all the stuff that goes along with it. So I help people emotionally, help them understand the thoughts, help them deal with their fears of treatment, reoccurrence. How am I going to get through this? What am I going to tell my kids? How am I going to deal at work? So we deal with all aspects of the cancer treatment. I like to joke that my colleagues in the white coats treat the tumor. Psycho-oncology does everything else. As soon as a patient's told about breast cancer, the first thing they do is go in shock. And that's an overwhelming numbness. There's fear of, am I going to live through this? What does this mean to my life? What does it mean to be a cancer survivor? What does it mean to be as a woman? I'm not sure that there's any one specific overreaching giant issue that comes immediately to mind, but there's always fear of, am I going to die? How am I going to tell my family, my loved ones? What does this mean about my future? How am I going to get through treatment? And of course, there's always the issue, what does this mean about my personhood as a woman? Am I going to lose my hair? Am I going to lose my breast? What am I going to look like? How am I going to go out in public? So there is no one really specific issue. I mean, it's all encompassing. In most local communities, the American Cancer Society will provide a listing of groups that are available. So I would encourage to check out with the American Cancer Society, the Komen Foundation, the local treatment centers that have, the local oncology centers should all have referrals to sources where people who don't have the resources, except in some very outlying rural areas where there aren't a lot of anything, there should be resources for everyone. You know, maybe I'm being a little idealistic, but I hope that to be the case. Really, oh, that's the other place that people can go for help is the American Psychosocial Oncology Society, APOS.